Hello, my name is Mackenzie Enmeier, and I am a second year at the OSU College of Osteopathic Medicine here at the Cherokee Nation. The presentation that I will be presenting at OSU Research Week is the Association of Intimate Partner Violence and Maternal Comorbidities, a cross-sectional analysis. Below are the contributing authors to this paper. Intimate partner violence, or IPV, is the act of inflicting physical, sexual, and/or emotional assault with coercive control. IPV is a traumatic experience, and the repercussions can be exacerbated in pregnant women by imposing risk on mother and child. Screening methods are useful for assessing the presence of IPV, especially because IPV does not always present with warning signs, and some women attempt to conceal abusive relationships. As such, the U.S. Preventative Service Task Force recommends routine screening to support accurate detection of IPV and to improve outcomes of women experiencing IPV. However, screenings for IPV are not always conducted. A 2019 study showed that among 24 states, less than 50% of women reported have been screened for IPV during pregnancy. As for our objectives, screening for IPV during pregnancy is recommended to occur regardless of risk, identifying clinical factors associated with increased risk for IPV during pregnancy. There are several known socioeconomic risk factors for IPV in pregnancy, but medical factors have hardly been assessed. Thus, our primary objective was to examine associations between IPV and maternal comorbidities. As for our methods, we conducted a cross-sectional analysis of the Pregnancy Risk Assessment Monitoring Systems, or PRAMS, Phase 8, spanning 2016 through 2019. We used variables within PRAMS, asking if during pregnancy or in the last 12 months, the respondent had experienced IPV. Bivariate and multivariable logistic regression was used to calculate adjusted odds ratio to determine associations between IPV and diabetes, hypertension, depression, asthma, polycystic ovarian syndrome or PCOS, anxiety, and thyroid disease. Confidence intervals were set to 95%. For our results, of the 140,000 participants, about 5,482 reported intimate partner violence, which represents approximately 240,000 or 3.43% of women in the U.S. from 2016 to 2019. And so, as you can see, anxiety, depression, asthma, and hypertension were statistically significant to be correlated with intimate partner violence, while the others were not. So clinical implications for this, while many major medical associations, including the American Medical Association and the American College of Obstetricians and Gynecologists, recommend routine screening for IPV among women, screening does not occur very often, with one study showing that 14% of women presenting with orthostatic fractures for an IPV-related injury were asked about IPV, and the rest were not. Thus, more widespread adoption and implementation of IPV screening in the clinical setting using validated tools such as the Women Abuse Screening Tool and the Partner Violence Screening Tool, and the Composite Abuse Scale to identify IPV are recommended. Screening alone was shown to reduce recurrence of IPV and associated mental health systems while improving quality of life scores. Recognition of these risk factors that we found can improve timely identification and or prevention of IPV. IPV is common in pregnant women which imposes additional risk for mother and child. And we found that an estimated 3.43% of women in the US have experienced IPV while pregnant. Nearly half of these women had previously been diagnosed with anxiety or depression. However, other comorbidities such as hypertension and asthma were also common in pregnant women experiencing IPV. Physician intervention is key in order to end traumatic circumstances towards pregnant women. Therefore, it is recommended to implement clinical guidelines to identify intimate partner violence in women with these comorbidities. And that is all I have. Here is my contact information if you have any questions or comments. And below are the other contributing authors as well. So thank you so much.